one of the people who has questions to put to the CS. I am sure he will get opportunity to say what he wants to say. But for me, Honorable Speaker, I was holding brief for the Senator of Migori, who had a question to the CS for water regarding the Lower Kuja irrigation project. Honorable Speaker, this is the one CS I have never seen. I don't know how he looks like. If we met in the streets, I wouldn't know who the CS for water is. I don't even know his name, Honorable CS. I was looking forward to see his face. And the majority leader, I think there should be an induction, even when you say he's a new CS, there should be an induction for CSs. Part of the problem why your government is struggling, Honorable Majority Leader, and the President has said it. No. The President has said it himself, that he struggles to be the only person communicating government policy. And it is true. Because who is this person who holds this docket of water? I don't know him. I don't know if that gentleman walked in. Maybe he's even present in this house. Nobody knows who he is. We were just asking ourselves here, amongst the minority leadership, Honorable Speaker, is he a man? Is he a woman? Nobody knows. So, Honorable Speaker, we want to say this. We are disappointed, and we always record our disappointment. But if we want to understand the government policy, we need these cabinet secretaries to interact with us. Yesterday, I ran into the former CS for Energy, David Chirchir, one of the most astute and one of the few cabinet secretaries that I respect, because he interacts with members of this house. He explains government policy. Yesterday, I was saying, if he was still in that docket, I am sure the drama you are seeing in Nairobi of the Nairobi County government dumping garbage outside the Kenya Power offices and Kenya Power retaliating by cutting power to the county government offices, you would not see those things because he would take leadership. Honorable Speaker, if you look at the relationship between county governments and national governments, they are supposed to be cordial. Where you see a cabinet secretary, there is a fight in your docket, but you do nothing at all. All you talk about is 2027 politics. You have failed as a cabinet secretary. So, Honorable Speaker, we want this gentleman to at least appear. Let him not fear this house. We want to be his friends, at least from the minority side. We want to confirm that we mean well. We want to have a discussion with him about these water projects. Let him not shy away, and let him be trained that if there is going to be an event that takes him away from the capital, he should communicate early, as the majority leader said. Thank you, Honorable Speaker.
Yes, I agree with you, Honorable Senators and leadership, but you should learn as fast as possible that communication is very key. And there is nothing impromptu, as the majority leader said. So the CS has been guided accordingly by the Senate that he should be communicating early enough. And you said you don't know his name. He's not Hashim, but he, Engineer Eric Muredi Muga. Yes. And I represent him in the Senate, but not on this matter. Yes. Because I'm the Honorable Senator for Meru. Yes. Elected by majority vote in Meru, more than 350,000, out of the 400-something thousand voters that didn't vote. But I agree with you, we really need respect as the Senate. Even if he is my brother, he really need to handle Senate with a lot of respect and decorum. He has no choice. Therefore, if the CS is around for health, you can now welcome her to the Senate. Okay. Honorable Senators, the CS for Health is here. Dr. Deborah Barasa and your team, welcome to the Senate of the Republic of Kenya. And we are here to interact with the 4 questions that the Honorable Senator has raised on this floor. And I can see you are prepared and your team to answer them. We start with the question number 016 by the nominated Senator, Senator Catherine Muma, who is also going to represent the Speaker in another forum in the next few minutes. So let's first dispense of your question. Senator Catherine Muma.
Thank you, Honorable Speaker, for giving me this opportunity. My questions to the, and welcome CS Baraza to the Senate. We've been longing to ask you a number of questions. I'm glad you've managed to come this time. My first question is, could the Cabinet Secretary provide details on the availability and affordability of life-supporting prescription drugs for persons with disabilities living with seizure-related ailments such as epilepsy? The second question is, which pharmaceutical manufacturers, suppliers, and distributors are collaborating with the Ministry of Health and the Kenya Medical Supplies Authority to ensure the availability of these medicines, and what are the terms of their operation? The third question, what steps has the ministry taken to ensure that these life-saving drugs are included in the essential drugs lists and made readily available under the existing public national health insurance scheme? Thank you.
CS Health.
Honorable Speakers, Honorable Speaker and distinguished members of the Senate, it is indeed a great honor and a privilege to appear before this esteemed House today. I sincerely appreciate the invitation to engage with you on the Ministry of Health's ongoing efforts to ensure the availability of quality, accessible, and affordable healthcare services for all Kenyans. The Senate plays a vital role in shaping national health policies, and I welcome this opportunity to present our initiatives and collectively explore ways to strengthen healthcare delivery across the country. This occasion also marks my inaugural appearance before this honorable House as Cabinet Secretary for Health. I take this opportunity to reaffirm my commitment to transparency, accountability, and constructive engagement with the Senate in advancing Kenya's health agenda. As we navigate the evolving healthcare landscape, I recognize the Senate's pivotal oversight role in ensuring that the government's health policies and programs effectively serve the needs of all Kenyans. As we move forward with the implementation of Taifa Care, our flagship model for achieving universal health coverage, I look forward to forging a strong partnership with this House. The success of this transformative health agenda depends on the collective effort of the executive, the legislature, the county governments, and other stakeholders. And I am confident that through close collaboration, we will make significant strides in realizing a robust, inclusive, and sustainable healthcare system for all. Honorable members, I will now move to the question by Senator Catherine Mumba. Honorable Speaker, honorable members, medicines used in the country must meet strict regulatory requirements to ensure safety, efficacy, and quality. They must be, first of all, registered and retained by the Pharmacy and Poisons Board. However, if a medicine is selected for inclusion in the essential list but is not yet registered in the country, it may undergo an expedited registration process to facilitate timely access. Secondly, it must be listed in the current Kenya Essential Medicine List 2023. Additionally, for these medicines to be available to the wider public, they need to be stocked by KEMSA as guided by Kenya Essential Medicine List 2023, Kenya Essential Medical Supply List 2023, and the Kenya Essential Diagnostic List 2023. Currently, KEMSA stocks a number of anti-epileptics or anticonvulsants such as lamotrigine tablets, valproic acid tablets and syrup, phenytoin tablets, phenobarbital tablets and injections, midazolam injections, magnesium sulfate injections, levetiracetam injections, gabapentin tablets, diazepam injections, and tablets. It is imperative that the counties draw these commodities from KEMSA to ensure consistent supply to the deserving patients. With regards to which pharmaceutical